Is it true that some cancers can invade and spread to other parts of the body and others don't? Yes, that is actually true. And certainly in breast cancers, there are broadly speaking two different types: invasive and in situ or in situ carcinoma. And in this video, I'll talk about why these cancers behave the way they do, which type actually does invade, and how are they best treated. So broadly speaking, there are two types of breast cancers: invasive and in situ or in situ. First of all, let's talk about invasive breast cancer. So invasive breast cancer means exactly that. It can invade other parts of the body. It means that it's a type of breast cancer that can spread to other parts of the body beyond where it started from. The breast itself is made of ducts, lobules, fatty tissue, as well as glandular tissue. And there are a few types of invasive breast cancers. The commonest type is called invasive ductal carcinoma. And it's called ductal because this type of cancer originates from the milk ducts. The second commonest breast cancer is called lobular cancer. And from the name, we can tell that this type of cancer originates from the lobules of the breast. There are other less common types of invasive cancers, and I've listed them on this screen. So as I mentioned earlier, invasive cancer means it can spread to other parts of the body. And these other parts include bones, lung, liver and brain. When this happens, it's called metastatic breast cancer, secondary breast cancer or stage 4 cancer. And whilst at this stage the cancer is not curable, there are treatment options that can prolong life. And I've actually made a video talking in more detail about metastatic breast cancer, and I will leave the link in the description below. Now this is different to in situ or in situ cancer, which is the second type of breast cancer. In situ means situated in the original place. So if we're talking about cancer, in situ cancer is found within its original place and doesn't have the ability to spread elsewhere. Ductal carcinoma in situ, or DCIS, means that the cancer originates from within the milk ducts of the breast and it's confined to the ducts. Is not found in any other parts of the breast and doesn't have the ability to spread to other parts of the body, unlike invasive cancer. DCIS is the type of cancer that is picked up on screening mammograms, and they usually present as abnormalities, usually microcalcifications on mammograms, rather than presenting as breast lumps. The treatment of these two types of cancers can be different. And as you may know, breast cancer treatment can involve surgery, chemotherapy, radiotherapy, anti-hormone treatment, as well as immunotherapy. If you have invasive ductal carcinoma or any type of invasive cancer, then all of these treatment options would apply. You may not get all of them because it does depend on the characteristics of the cancer itself, such as the hormone sensitivity, the size, the grade of the cancer, and whether any of the armpit glands were involved by cancer. On the other hand, if you have non-invasive cancer such as DCIS, it's unlikely you'll be recommended to have chemotherapy or immunotherapy. And in many instances, surgery with or without radiotherapy may only be the treatment you would be recommended to have. So you may wonder then, if DCIS doesn't spread to other parts of the body, then why treat it at all? And that's actually a good question. There are 3 grades of DCIS: low, intermediate and high. And the worry is that if these cancers are left untreated, could they become invasive, which will then have the ability to spread? The truth is, we don't have enough information at the moment to confidently say that we can leave any of these cancers untreated. And at the moment, we are awaiting results of a trial that is trying to answer that specific question by looking at the low and intermediate grade DCIS. It is trying to answer the question whether leaving low-risk DCIS left untreated would be harmful. And until the results of this trial comes out, we are treating all grades of DCIS with surgery. Let me know if you found this helpful, and I will see you in the next video.